This just in. Lack of physical activity is the second leading preventable cause of death and disease, right behind tobacco use. Yet less than 25% of Americans get the recommended amount of exercise. Ding, ding, ding. That's all true. According to the American College of Sports Medicine, the CDC, and the American Heart Association, people can realize the health related benefits of physical activity by doing a minimum of 150 total minutes of moderate intensity cardiorespiratory activity per week, or 75 minutes of vigorous intensity activity per week, or some combination of the two. The low level recommendation is to do 30 minutes of continuous, moderately paced walking 5 days a week. But two important points need to be made. First, it's the total amount that you need to focus on. Any combination of moderate to vigorous paced activities that adds to the total, it all counts, and it doesn't have to be continuous. You can do any combination of 5 minutes to 150 minutes of intervals in several times a day or across 7 days, and it's all the same. Second, it's your heart rate that determines the intensity that you're exercising. Everyone has different levels of fitness, as well as other factors that affect heart rate. Moderate level activity is generally defined as somewhere between 50 and 65% of your maximum heart rate for your age. Vigorous activity is somewhere between 70 and 85% of your maximum heart rate based on your age. There are several different formulas for calculating target heart rate, but the easiest way to do it is to subtract your age from 220 and then multiply that number by the desired intensity. For example, if you're 40, it's 220 minus 40 equals 180 times 50% intensity equals a target heart rate of 90 beats per minute. Most cardio machines nowadays have heart rate monitors built right into the handles, grips, or rails. Other ways, heart rate monitors can be purchased for as little as $10 online or in sporting goods sections of most department stores. Or you can easily learn how to take your own pulse at the brachial artery in the wrist or the carotid artery in the neck. For a radial pulse, take your index and middle fingers on your right hand and place your fingertips on the underside of your left wrist just below your hand and about a half inch off center towards the thumb side. For a carotid pulse, take those same two fingers, touch your right earlobe, then move those fingers straight down under your jawline on your upper neck. In either case, use light pressure and you should feel a pulse. Then it's just a matter of counting the pulses in an allotted time frame using the stopwatch function in your phone's clock app. It's generally easiest to shorten the time frame to 15 or 30 seconds and then just multiply your count by 4 or 2 respectively. That will give you your pulse rate per minute. If you enjoy this type of content, please like this post and subscribe to my channel. Until next time, make better choices and get healthy.